Hello, everyone, and thank you for joining us for the American Journal of Managed Care's Healthcare Reform Stakeholder Summit, Spring 2015 Peer Exchange video program. My name is Dennis Scanlon, and I am a professor of health policy and administration and director of the Center for Healthcare Policy Research in the College of Health and Human Development at the Pennsylvania State University. I'm joined today by several panelists, Mr. Francois de Brantes, Executive Director of the Healthcare Incentives Improvement Institute, Dr. Ateev Mehrotra, Associate Professor of Healthcare Policy and Medicine at Harvard Medical School and a hospitalist at Beth Israel Deaconess Medical Center. And finally, Dr. Arthur Vercillo, Regional President, Excellus Blue Cross Blue Shield. Thank you again for joining us, and let's get started. So, first topic I wanted to cover today is value-based purchasing. We hear a lot about getting value for money spent in healthcare, and that's sort of interesting when one thinks about the value that we receive in other industries. When we talk about value, and Ateev, maybe I'd ask you this question, what are the goals of value-based purchasing programs?
You know, Dennis, I think it's, at its heart, it's very simple. We've had a healthcare system that's really focused on volume, and we wanted to create the incentives for providers to focus more on quality. More energy devoted to quality improvement, and that was the hope is it's going to have a lot of benefits. It's going to make better health for our patients. We're also going to hopefully, if we improve health, we're going to decrease costs, and I also think just generalized, we're going to improve efficiency in the healthcare system. And one of the things I think it's useful to think about when we talk about value-based purchasing is that at its core, it first started, which is we're going to pay Art here as a surgeon more or less based on the outcomes he has for his endocrine surgery. Though I think people have thought more about value-based purchasing a little bit more broadly now and incorporated things such as ACOs, bundled payment, all which do create those incentives to improve quality and decrease costs, but maybe not in the same way that we originally thought about value-based purchasing.
So certainly multiple stakeholders are affected by value-based purchasing programs, and I want to talk about that in a moment, but maybe Francois, who drives these value-based purchasing programs? Who needs to sort of take the reins and lead?
Well, for the time being, it's mostly payers. And I'm going to put them in two categories. So you've got employer purchasers on one side who I think are finally realizing that, much like the federal government, they have to take a more active role in directly contracting with providers or instituting different forms of value-based payment. And I think it comes out of a frustration that, for the most part, in the payer community, it's taken a long time to really go out and aggressively contract around payment other than fee-for-service. But there's also the consumer as a payer. And I think the movement in the past decade or so towards a far greater increase in out-of-pocket expenses for plan members has created a completely new generation of purchasers who are not employers, who are not health plans, but who are consumers. And so the combination of these forces is really driving, I think, the change in the mode of paying for care.
You know, I would have to agree with you completely when you say the consumer is really a driving force there. I mean, after all, the whole point of the Affordable Care Act was to get adequate coverage for as many Americans as possible so that they would have safe, effective, affordable health care. In this great country of ours, there isn't anybody that really should go into bankruptcy, for example, because they're getting good, effective health care. It's the public that's really driving it, and when the payers are trying to exert an influence on it, it's usually because they're hearing from the public themselves. And all of us eventually will be one of those patients, and all of us have those expectations. And for value, value is really looking at both cost and quality. And we've been paying a great deal publicly and as individuals for health care in this country, and I'm not sure we've always gotten our money's worth. So this is a great step forward to try and get the American public what they're paying for.
I'd be curious what your response to this, Art, is, though. When we talked about value-based purchasing, you asked the question, Dennis, who's driving this? And we talked about payers in general, but I'm curious whether other panelists agree or disagree. There is a kind of a few that it's really Medicare. That Medicare dictates we're going to start doing value-based purchasing for inpatient care. And then all the private plans sort of follow suit. We're going to do patient-centered medical homes and the private payers. And we've had this idea that the private payers, like Excelis and others, are going to be innovative and try new options, but there seems to be a bit of a Me Too thing where Medicare seems to be driving, the big gorilla in the room, and then everyone else is following suit. And maybe that's good or bad, but I'm curious whether, and maybe I'm being too simplistic.
Yeah.
Well, I think if you look at the history of the movement, Ateev, it started with employers in, well, it's always started with employers. But if you go back to the early 2000s, where employers were aggressively pushing not just the leapfrog group, but other forms of pay for performance, and then finally the patient-centered medical home, and starting to experiment with things like bundle payment, the ACA, to a large extent, codified what the private sector was doing and turned Medicare onto it. So I think it had, the kernel started with the employer community. It then grew and blossomed with the ACA and CMMI. And now the private sector is, I think, reasserting its appropriate role in taking those models and trying to disseminate them and operationalize them in a broader way. So it's an interesting evolution, and I agree with you that I don't think that the private sector payers, the commercial payers, would have gotten to the point they're at today had it not been for the ACA, had it not been for CMMI. But now we need to rethink about that balance between the signals that are sent by the federal government, how long it takes them to modify and adapt to the change in the environment, and what the private sector could and should be doing to move the momentum further.
And actually,